Hi. Hi, Miss Cynthia. I'm Natasha Rahman, and today I'll be your nurse. And do you have any questions for me before we get started?
No.
All right. So I'm gonna pull down the curtains and then give you some privacy, and then I'm gonna perform hand hygiene. How are you doing today?
Good.
All right. Could you please confirm your name and date of birth for me?
My name is Cynthia and my date of birth is August 1st, 2000.
All right, perfect. So first of all, before I start the procedure of the head to toe assessment, I'm gonna ask you a few questions. Do you know where you are today?
Yes, I'm in Santa Clarita,
Um,
in Henry Mayo Hospital.
all right, do you know what date it is?
It's 9th of August.
All right. And do you know who's the President of United States?
Yeah, Trump.
All right. That means you're alert and you're oriented, which is really good. Do you have any pain or allergies?
No.
All right, so we're good for now. And our CNA just checked your vitals and they looked all stable and normal. And right now I'm gonna begin with your skin assessment. So your skin looks really nice and warm as expected. There are no scars, no lesions, no discharge, no rashes. Your skin looks good. And I'm gonna start with your head first. Okay, so I'm palpating your scalp, and as I'm seeing, your hair is evenly distributed. There's no signs of alopecia. There is no scars or any masses. And I'm gonna palpate your neck, inspect your neck, and they all look like they don't have any discoloration, no masses, and your lymph nodes look non-tender and non-palpable. And I'm looking into your anterior cervix and then posterior cervix. And I'm looking into your supraclavicular bones. All right, they all look pretty good and look good in shape. And then I'm also gonna use my pen light to assess your ear. Your ears look pink and intact. There are no discharges. Have you ever used a hearing aid?
No.
All right, so no hearing aid for you. And right now I'm just gonna check your nose. I'm gonna ask you to tilt your nose real quick. All right. Your mucosal membranes look pink and intact. There are no discharge. And have you had any nose bleeding lately?
No.
All right. No, nothing. I'm gonna have you open your mouth a little bit for me. All right. Your mucosal membranes look pink and intact. There's no bleeding, and you seem to be well groomed. All right. And now I'm gonna check your carotid artery. I'm gonna auscultate with the bell of my stethoscope here. All right. As I can see, there are no bruits present. So I'm gonna have you quickly turn your head to the right. And then again, I'm gonna have you turn your head to the left. So your JVD comes negative. That's good. And right now, I'm gonna check all of your cranial nerves. And so I'll begin with cranial nerve 1, which is the olfactory. So I'm gonna have you close your eyes and then I'm gonna ask you to identify a few scents for me. Can you guess what this could be?
Perfume.
All right. What about this one?
Coffee.
All right. So you got that right. And then you can open your eyes. And now our CNA already assessed our CNA already took your eyesight test, and you have a 20/20 vision, which is normal, and that's perfectly good. And so your eyes are in good shape, and I can tell. Now we're gonna work on your cranial 3, 4, and 6 nerves. Okay. So we're gonna start with the pupillary reflex. I'm gonna put light on your both of your eyes one at a time, and I'm gonna have you look at me. I'm gonna have you focus. All right, so your pupils look equal, round, and reactive to light, which is great. And now I'm gonna do the 6 cardinal gates. So I'm gonna have you follow this pen. All right. Okay, and now I'm gonna check for your accommodation, okay? So every time I bring this pen forward or backward, you're gonna have to follow it. All right, very good. Looks like your cranial 3, 4, and 6 nerves are intact. So I'm gonna check for your 5th cranial nerve now. I'm gonna have you close your eyes, and I'm gonna have you tell me that whether you feel this object being put on your face or not, okay? And I'm gonna have you close your eyes real quick.
Yeah, I can feel it.
What about now?
Yeah.
Okay, perfect. Okay, so you can open your eyes, and now that I'm gonna assess your cranial nerve 7, I'm gonna ask you some questions. Have you recently had any changes in your mood, or have you been sad lately?
No.
Okay. Or all right. So to check for your cranial nerve 7, I'm gonna ask you to raise your eyebrows for me. All right. I'm gonna have you smile. I'm gonna have you puff your cheeks, and I'm gonna have you clench your jaw, real quick. All right. That looks good. So it shows that your cranial nerve 7, which is the facial nerve, is intact. All right. So I'm gonna start with cranial nerve 8 right now. So I'm going to do a quick whisper test. I'm going to whisper something on your ear, and I'm going to have you say it out loud to me, okay? To make sure that you did hear it.
Apples and oranges. Red and blue.
All right, looks like you got everything right, but I have to do one more assessment for cranial 8. So I'm going to have you check your balance and gait. All right, I'm going to have you get out of the bed. Nice and slow. Okay, and I'm gonna have you walk around for me. And first of all, I'm gonna have you have your hand on the sides and walk straight. And then I'm gonna have you walk back again. I'm also gonna have you do the same thing, but this time you're gonna have to close your eyes. Okay? All right, looks like your cranial nerves 9, 10, and 12 are intact. That's really good. Okay, I'm just gonna have you sit down back in bed again. Okay, so looks like your balance and your gait is absolutely fine. And this time I'm gonna have you do a quick shrug on your shoulder. What? I'm gonna have you do like a quick shrug on your shoulder to make sure that, to see if your cranial nerve 11 is working. And I'm gonna, for 8, 9, and 12 cranial nerve, I'm gonna ask you to stick out your tongue for me. All right, and I'm gonna have you swallow. And right now I'm gonna put something on your mouth to check if you have gag reflex. That prevents you from choking. All right, looks like you have a gag reflex, which is amazing. And I'm gonna have you check your muscle strength for me. So I'm gonna have you pull my hands up. All right, so I'm gonna have you put your hands up like that. And then I'm gonna have you extend your arms like this. All right, looks like You can pull your hand up and down. You can extend your arms. And I'm going to have you rotate your wrist real quick to make sure that you have a complete range of motion on your upper body. Looks like you can do that successfully. That's great. Good job. You're doing great so far. All right. And right now I'm going to check your capillary refills real quick on your fingers. And it looks like it's less than 3 seconds, which is normal. And that's great. And right now I'm going to do your tendon reflex on the upper side of your body. So first I'm going to start with the bicep reflex. I'm going to have you flex your arm. All right. And then I'm going to have you flex your arm. I would like you to get up a little bit. Okay, looks like that's working. And then now I'm going to do the brachioradialis tendon reflex. That's also working pretty well. Okay, so you're doing great so far. And right now, I'm going to check your heart sounds real quick with the bell of the stethoscope. So to begin with, this is your angle of Louis. So first I'm gonna check the heart sound, which is on the right side of your second intercostal space. This is the aortic location of your heart. And this is where the S2 is greater than S1. And the left side is called pulmonic. And the pulmonic is also on the second intercostal space. And this is your Erb's point, which is on the third intercostal space, where the S2 and S1 are equal. And the fourth one would be tricuspid, which is on the fourth intercostal space. And I would say that this is where the S1 is greater than S2. And last but not the least, the apical space. I'm going to have you sit right here. The apical the apical heart sound, where it's in between the fifth intercostal space of the mid-clavicular line. And this is where the S1 is also greater than the S2. All right, and now I'm going to take your apical sound for 1 exact minute. Okay. All right, looks like it's 78 beats per minute, which is normal. That's amazing. And as I can see that your S1 and S2 are audible. And right now I'm going to check for your breath sounds. So I'm going to do the posterior one first. I'm going to have you lean forward for me, and you're going to have to take deep breaths for me, okay? All right, I did all the 8 sides. And I'm going to have you take deep breaths again. All right, your breath sounds look all clear. There's no adventitious breath, and there's no adventitious sounds, and your lung sounds look very clear, both anteriorly and posteriorly and laterally. So that's great. And now I'm going to check for your abdomen. When was the last bowel movement you had?
This afternoon.
Okay, what was the consistency and color of it?
It was brown and it was hard.
Okay, and when did you last urinate?
An hour ago.
Okay, perfect. And what was the color and the consistency of it?
Light yellow.
All right, that's good. I mean, that looks normal. So I'm going to inspect your abdomen real quick. So it looks like your abdomen is free from any discoloration. There's no lesions. There's no scars. Everything looks perfectly fine, and it's flat. So actually, I'm going to have you lie down supine position. I'm going to have you lie down flat, okay? Okay, so they all look pretty good. And now I'm gonna auscultate your abdomen, okay? So I'm gonna begin with the um, right lower quadrant, which is right here, and then I'm gonna go all the way to upper right quadrant, and then I'm gonna go to left upper quadrant, and then left lower quadrant, okay? All right, your bowel sounds look normal active, which is completely fine. And as I can see that I'm gonna use right now, I'm gonna use the bell of the stethoscope to actually listen to your abdominal artery and see if there are any roots. So I'm gonna use the same process: right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. All right, so it looks like there are no roots in your stomach. That's great. And now I'm gonna have you do like a lower extremity assessment. So I'm gonna inspect for any scars or any lesions. They all look perfectly fine, and there are no scars or any discharge or any abnormalities for so far. And I'm gonna have you sit. No, it's okay. I'm gonna have you put your legs up for me. I'm gonna have to check for your strength. All right, looks like they look good. And I'm gonna have you have your legs push my arms, push my hand. All right, so looks like you have muscle strength on your lower extremity. And then I'm gonna have you bend your leg real quick, and then I'm gonna have you pull up your leg to the side. So put one leg straight, and then I'm gonna have you pull the other one on the side. All right, and do the same thing for the other one. Okay, so it looks like you have a full range of motion for your lower extremity. And right now, the last thing I'm gonna want to do is I'm gonna do your patellar reflex. All right. Actually, I'm gonna have you sit down. Looks like you have your patellar reflex, and right now I'm gonna check your capillary refill. So I'm gonna have you sit back again for me. Sit. All right. So your capillary reflexes look fine, and now I'm gonna check for your femoral pulse. They all look normal. Your popliteal pulse, your dorsopedial pulse, your tibial pulse. All right, they all look normal to me, as expected. And do you have any other questions for me before we end this assessment?
No.
All right, everything looks completely normal. And here's the call light in front of you. If you need anything, please let me know, okay?